Good day. My name is Dr. John Dombrowski. I'm the director here at the Washington Pain Center. It's January 2020, so Happy New Year to you. I always want to bring you new information when I get it in terms of how we can help patients with new modalities. Or maybe more importantly, it's the same modality but a different twist on it that will make it easier for patient care. And that's really what it's all about. As you know in my past videos, I've always really been a big advocate for neuromodulation. The other term is spinal cord stimulation, or another term is a pacemaker for pain. So if you had surgery that didn't turn out very well, all the hardware has been placed, and still are in pain, we'd love to see you here. We normally do injections, maybe medication management, but at the end of the day, if those aren't really helpful, what else is in the bag of tricks? Well, since the 70s, we've done traditionally as anesthesiologists spinal cord stimulation. And what does that involve? Usually involves a lead such as this, and the little lead has little metal bands on it. That lead then would be connected to a battery and a computer, and that battery and computer is a size, it's a pacemaker. It's a little bit larger than this is a small version. And this would then stay in the body, it can be recharged, or sometimes it's fixed life. Now the good news about it now with technology here in the United States is we've been able to make this better. Well, how do we make it better? Now we have MRI compatibility. That's the big thing with these instruments for spinal cord stimulation is if you got one, it was really difficult, if not impossible, to get an MRI. Most of my patients want that MRI possibility. So now the company called StemWave has come up with a similar idea, but a clever version of it. So again, it's the same lead as before, but instead of the battery being underneath and things like that, gets tucked underneath the skin, it's a small little antenna. Through the antenna over the skin is essentially this little device here, and it sits just on top of your skin, and it connects to the antenna to give it energy to drive the spinal stimulation, as well as a computer you can change it. And this little thing, this is just a demonstration model. This kind of clicks on your belt, and it's customizable. You can change the programs by a click of a button. Pretty darn clever. And a lot of patients do like it because there's no chance of any erosion of the battery or getting the battery needs to be changed or other things like that. And again, more MRI compatible. Now the other thing this thing has been able to do instead of traditional spinal stimulation is peripheral nerve stimulations. Anesthesiologists have done peripheral nerve injections really since the 90s. And we've done a lot with orthopedic surgeries for total knees and hips and shoulders. It's the exact same thing. If you've had a total knee replacement, a total hip replacement, a shoulder replacement that really hasn't turned out all that well, and it only hurts in one particular area, this is a very clever device just to fix one area. Why am I taking pills that go over my body when I just need one area treated? My elbow, my shoulder, my knee. The orthopedic surgeon says there's nothing more we can do. We've got your hardware in place. There's no problem with the metal. It's good hardware, but I still have pain. Again, that's when we love to see you. What we can do is a trial to make sure you like this. Then this lead gets just very near the nerve called the geniculate nerve for the knee or other nerves, and we can then stimulate that nerve to take away that localized pain, shoulder, elbow, knee, hip, etc. I hope you find this information helpful, and we would love to see you in the practice to obviously talk more about your current condition. Thanks for watching.